Hey, it's Kristen here. Have you ever decided or maybe been convinced by one of your friends to enter an event like a 1-mile run, a 5K, or maybe even a marathon? To be successful, it is helpful to plan and prepare for one of these events. Well, pregnancy is a little like this. Although it's not a race, it is a life-changing event. Preparing is usually very beneficial. Here are some steps to help you get ready for this big event. Number 1 is stop contraception and track your cycles. If your periods were regular before starting some kind of hormonal contraception, they should go back to their regular, predictable pattern within 2 or 3 months. If your periods were irregular or you've had changes in your health conditions, for example, started new medications, had a change in a chronic health condition, or possibly gained a significant amount of weight, those things can also alter your cycles. Don't stress if you don't get pregnant within the first few months. 85% of couples can get pregnant within the first 12 months of stopping contraception, so tracking your cycles is very beneficial. Number 2 is physically get yourself in shape. I don't care if you're 2, 22, 82, pregnant, not pregnant, man or woman, we all need to be exercising regularly. Our bodies are made to move. Regular physical activity will help decrease potential complications for you and your baby. It often makes labor a little bit easier, a little bit faster. It helps you to recover a little bit more quickly in the postpartum period. It modulates weight gain during pregnancy and plays a huge role in improving and regulating moods. Now, there are a few women who need to limit or stop exercising altogether for brief periods of time, but if you have questions on this, you should talk to your provider. Number 3 is to nutritionally get yourself back on track. In general, we should be eating lots of vegetables and fruits, have lean sources of protein in our diet, and small amounts of healthy fat. Avoid processed foods and simple carbohydrates. Anything that is boxed, bagged, or canned, you should at least think about before consuming. Avoid going out to eat frequently, which also means bringing things in. A prenatal vitamin should be started 1 to 3 months before you think you want to try to get pregnant. That way you can ensure all the vitamins and minerals that your baby will need to grow are at least in place. Number 4 is to emotionally prepare. If you have depression or anxiety, maybe some self-esteem issues or relationship problems, getting pregnant is not going to help. In fact, it might make it a little bit harder to treat simply because physically, emotionally, hormonally, chemically, you feel a little bit different. And our treatment methods are somewhat limited when women are pregnant. Get on top of psychological health and mental health issues first. This doesn't mean that life is going to be perfect and you're always going to be happy. That does mean that you have a good support system and some good coping skills in place. Number 5, if you are taking medications, you should talk to your provider about the safety of continuing these or stopping these during pregnancy. That could be prescription medications, over-the-counter, or supplements. Know that alcohol is never safe for a fetus. Smoking or tobacco or vaping are also harmful for you and your baby, and illicit drugs are never safe. Number 6 is financially know that you're never ready, but get your ducks in a row. If you have big financial stressors coming up, then figure out a plan for those things first. Babies aren't cheap, but they are totally worth it. After that, enjoy each other. Have fun together. Set goals, dream big, and then that way you can face the challenges that come your way together as a couple. And know that we will be here for you along every step of the way.